Welcome back to The Blend. Do you suffer with low thyroid problems? Meaning, are you fatigued, depressed, anxious? Those and more can contribute to it.
That's right. Well, our next guest wrote a book on the topic. It's called The Truth About Low Thyroid, and he's here to share his expertise on the subject and what you can find at Red River Health and Wellness Center. Dr. Joshua Red, chiropractic physician, joins us now with more. Hello, sir.
Hello. Thanks for having me. I see you again. It's great.
He's keeping tabs. Because I've been the diet, the thing that I've been on is part of a anti-inflammatory diet that you offer with Red River that has helped my blood pressure get from like a 165/100 to pretty much 120/80.
And I swear I saw you a month ago and you look markedly different. I mean, just you look incredible. You're looking great. So keep up the hard work. The sky's the limit.
Are you noticing at home?
Inflammation.
Right?
I think it's very interesting. It's being talked about more and more.
Huge. Yeah. We live in a highly inflammatory environment where we're doing lots of things that will create a lot of inflammation throughout the body, and it causes so many different symptoms with our brain, with the intestinal tract, with the liver, hormones. I mean, you name it. Even one of the first times when I first came on here, you could tell that Sean's face was just a little bit more inflamed, like he was retaining water, and obviously that causes high blood pressure and causes so many different problems. And already within 1 month, you see just decreasing the inflammation, doing the right things to improve the inflammation, and all of a sudden we have the results that we have right now. So
here's how you know that, okay, I haven't had caffeine in about a month and change, and I'm not falling asleep at my desk, which is refreshing.
Well, think about this. If somebody has, let's say somebody has caffeine and they have high blood pressure and inflammation, that's going to increase cortisol, which in turn just increases insulin resistance and causes more inflammation. That also causes problems with testosterone. It causes all sorts of different issues. And so not everyone has to avoid caffeine. There's lots of patients that can have caffeine, but if somebody has the high cortisol levels, having the caffeine will just increase the inflammation and so on and so forth.
So in my case, my situation wasn't a thyroid situation. My wife, however, is also doing Red River with me. She has Hashimoto's disease. Tell us about autoimmune low thyroid and what it means.
Yeah, so here's the thing. Most patients that have a thyroid problem, it's not a primary thyroid issue. They're actually suffering from a bigger, more complicated issue called Hashimoto's, which is an autoimmune disease. In this case, their immune system is destroying the thyroid. It's causing weight problems, depression, fatigue, restlessness, anxiety. It's causing a whole bunch of issues with the brain. It's causing hair loss. It's more of a systemic problem, right? So it can be pretty critical and pretty heartbreaking. So
now, at your office at Red River, you address these problems. These problems are common all across the country. You address them in a unique way. Tell us about it.
For sure, the biggest thing is we want to get to the mechanism of why these patients feel bad. A lot of these patients that suffer from autoimmunity or thyroid problems go to the doctor and they get more of a superficial type treatment, whereas we want to identify what's causing it, right? What are the underlying mechanisms that we can really work with? What are the dietary and lifestyle strategies that we can work with too? And then let's upregulate, enhance, and improve function, and then really teach the patient how to keep them in check.
Absolutely. Well, you wanted to share the story of Rebecca. Tell us about Rebecca.
Rebecca was struggling with so many different symptoms and so many different problems. She had Hashimoto's with other autoimmune conditions as well. She was struggling for the last 20 years. Her son was asked to draw a picture of her at school, and he drew a picture of her in bed. He brought that home. She pulled it out of his backpack, and she asked, "What's this?" And he said, "That's you, Mommy, because you're always in bed." And she knew right away that, look, there's got to be something else out there, and there is. But this just goes to show you, tons of patients are struggling and feel hopeless. Now Rebecca is doing so much better after 3 months. She's lost 20 pounds. Her quality of life is way better. She feels better than she had in 20 years. Her energy's up, she's functioning, and she just feels healthy again, right? But then she knows she has the tools to stay healthy. And that's kind of the biggest goal for us at Red River.
Half of it really is knowledge, just learning what you're putting into your body and what to avoid. And now when you go to the restaurant, you know exactly what to ask.
And what's cool is that we can do it really specific to you. Everyone's a little bit different. Even a Hashimoto's patient will be different than the next Hashimoto's patient. What you're doing is different than your wife, right? And so what's good for you might not be good for the next patient. And so being very specific and individualized, it makes all the difference in the world, for sure.
In addition to Hashimoto, low thyroid, and Sean's particular situation, you deal with a lot of people with autoimmune disorders?
Yes. So anytime the immune system turns on itself, it could attack the joints, it could attack the intestinal tract, the brain, stomach tissue, you name it. We do everything that we can to identify what's triggering the autoimmune response to flare up, and then we go in and try to dampen it and calm it down, and then teach them how to manage it more effectively. And so a lot of these patients that are on, have some form of autoimmunity, they are going from doctor to doctor, and they're getting medications to help with the symptoms, but nothing's being done to dampen
Fix
the
the
autoimmune
problem.
disease itself.
Yeah.
And so they continue to feel little to no improvement, and it's just this vicious cycle of problems. If you have autoimmunity too, it can just get worse and worse over time, but then also it can turn into other autoimmune conditions. And so a crazy stat that we're finding out with our office is half of our Hashimoto's patients actually have antibodies attacking brain tissue.
Wow.
Which is insane. And so think about this. These patients are going to the doctor, getting on thyroid medications, which is important. We're an advocate for that. But nothing's being done to calm down the autoimmune disease, and they have antibodies attacking brain tissue as well. Half of those patients we're seeing have that, which is crazy.
Fascinating.
We've run out of time. I want to make sure that people can take advantage of this special offer for Morning Blend viewers only. Come on in, and for a free consultation, you're also going to receive a free copy of the Amazon #1 best-selling book on thyroid, The Truth About Low Thyroid. Red River Health and Wellness is located on Pecos Road, just in Henderson, just north of the 215. You can contact them or visit the website. Call the number right there on your screen. The proud sponsors